In the emergency department, we deal with a vast variety of cases, which includes major trauma, massive heart attacks, and also an unconscious and unresponsive patients. So when these patients present to us, we have to assess the patient and we have to determine what life-saving measures we have to do for these patients, which includes intubation, which is for securing the airway, and also CPR, which is cardiopulmonary resuscitation. When you come to the emergency department, if you are a stable patient who is walking in on wheelchair, we will register you first at the registration counter. Then we will send you to the triage counter where you will be triaged. At triage, we will assess you based on your vital signs, which includes your blood pressure, your temperature, your heart rate, as well as your SpO2, which is your oxygen saturation. For the unstable, unconscious and unresponsive patients, you will be pushed directly to our resus zone, which is our critical zone, where necessary life-saving measures and interventions will be carried out without delay in time.
Okay, so at emergency department, we use a structured triaging system to assess the severity of a patient and also the urgency of the treatment. So based on this, they are divided into 3 zones, which is red, yellow and green. For red zone, it basically means critical or life-threatening. Example, patients who are unresponsive, ongoing heart attacks, strokes, active seizures and all that. So in this pool of patients, we would attend to them and treat them immediately. Second would be yellow zone, which means semi-critical. Examples, a child with high fever, motor vehicle accidents, industrial injuries, etc. etc. So in this patient, depending on the situation at the emergency department at the time, they will be attended and treatment will be initiated within 15 minutes or sooner than that. For green zone, it basically means stable or non-critical patients. Example of cases, adults with low-grade temperature, common cold symptoms, chronic back pain and all that. So in this pool of patients, treatment will be given within 30 minutes or sooner. Okay, so this is a question which I get very often. Do we actually take in anything except an accident or emergency? Of course we do. Here are the services. Medications with niche doctor's prescriptions. We can prescribe them for you to purchase at the pharmacy. Change of urinary catheters, also feeding tubes, follow-up of stable cases, dressings, sutures to open, and many more.